Hello everyone. Today we'll be seeing an interesting case of aortic valve implantation via transcatheter route, that is without opening a chest. This patient presented with severe aortic stenosis with a very high gradient. The plan was that he will undergo aortic valve implantation without opening his chest. That is the TAVI or Transcatheter Airtic Valve Implantation. Here you are seeing that we are crossing the valve. That was very difficult because it was calcified and the nature was bicuspid in nature. After that, you have to follow a protocol where we are going to predilate the stenotic valve. This is the actual valve, the artificial valve that's going to be implanted. You are checking with a pigtail shot, and then after confirming the positions, now the valve has been implanted in a proper site and there is no occlusion of the coronary arteries. It was done very nicely and patient went home after 2 days without much hemodynamic issues. So here is the importance of selecting the case and doing it properly. Thank you very much. Keep watching, keep subscribing.